Raleigh Orthopedic Clinic is the oldest orthopedic practice in Wake County. The more patients we see, the more revenue that comes in.
With randomized scheduling, we had a fair amount of patients that were scheduled weeks out in advance, so they would seek other providers or cancel their appointments.
It was a very manual process. We used wax paper with wax pens. Each provider had their name on the list, and the schedulers were required to go one by one down the list.
It definitely had an impact on our revenue as well as the patient experience. Patient satisfaction plummeted because patients couldn't get in, and they tended to no-show because they were seeking for other providers outside of our organization. Our tenured physicians were overutilized and our newer physicians were underutilized, which is one of the reasons why I looked at other platforms in order to grow the facility. The Relatient platform was extremely attractive to Raleigh Orthopedic Clinic because of its rules-based system.
Dash is definitely loved by our physicians. It's minimized our scheduling errors because their preferences are built into the system.
If a provider wants to see, the great toe but not the lesser toes, we have that ability to specifically tailor those triage questions.
We've seen a tremendous increase in productivity from our physician standpoint. Newer physicians had fuller schedules. The patient's experience was much better, meeting expectations.
20% of our patient volume is scheduled online, 32% of which is scheduled after hours.
It's increased our efficiency, it's decreased the no-shows with our appointment reminders, and just increased the overall patient experience with how simple it's made scheduling.
The reason why I went into orthopedics is to really help people, and a lot of the frustrations we used to have with patient access have been alleviated. We've actually had improved patient satisfaction. The wait times have been dramatically decreased. I can maximize the number of patients I see per day.
We are making sure that providers are busy throughout the week, but also not interfering with the patient's ability to get into the clinic. It allows training to be a lot quicker, a lot easier.
Walking in on my first day and utilizing Dash was probably the easiest system I've had to learn how to use. It makes scheduling very simple. I find that the calls go by a lot quicker when I'm able to schedule in Dash versus my EMR. Remembering all of their preferences can be a little difficult. With their preferences being built into the system, it makes it super easy for our staff.
I can tell you my relationship with Relatient has been exceptional and exceeds all my expectations.
It feels not that they're a vendor that we're working with, but a group of individuals that we're working alongside of.
Relatient has helped me help patients in a more efficient way.
If you are still doing it the old-fashioned way, you are making a huge mistake.
I would highly recommend Relatient to any practice with the complexity of scheduling and the different preferences. Relatient is your best choice.